is Ivy. I'm going to be your student nurse today. How are you feeling?
Doing good.
Doing good? Alright, I'm going to go ahead and put some gloves on. Okay, can I have your wristband? Alright, could you tell me your name,
Nadine Kaler,
date of birth,
April 7, 2000,
and medical registration number?
12345.
Alright, so that all matches my chart. And do you have any allergies to latex, food, medication, environmental, or tape?
No.
No? Okay, that matches my chart as well. Okay, Miss Kaylee, we're going to go ahead and go over your vital signs today. So you had a blood pressure of 120/78, a heart rate of 72, a respiratory rate of 18, an oxygen percentage of 99, and a temperature of 98.7. So these are all normal findings, so you're doing good. Do you have any pain I should know about?
I've had a headache for the past couple days.
Okay, and when did that headache begin?
A couple days ago.
Okay, and what's the location of that headache?
Behind the eyes.
Behind the eyes, okay. And is that pain on and off? Is it sort of constant?
It's persistent.
Persistent, okay. And is it like a sharp pain, a dull pain?
Definitely dull.
Okay. And is there anything that makes that pain feel worse?
Bright lights.
Anything that relieves that pain?
Turning the lights off.
Okay. And have you tried any treatments?
I haven't.
Okay. And on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain of your life, how would you rate this pain?
A 3.
A 3? Okay. So, go ahead and mark that down. Okay, I'm going to check, could you tell me where you are today?
Tampa, Florida.
Okay, and roughly what time of day it is?
About 1.
About 1? Okay, so patient is alert and oriented to person, place, and time, and their body is symmetrical. Okay, Miss Kayla, I'm going to check your oxygen cannula. Do you have any dryness in your nostrils or anything of that sort?
No.
Okay, and I see no breakdowns behind the ears. I'm going to check the line for any kinks. And there are no kinks, and it matches your provider's order, so that is good. And can I check your IV line? Okay, any pain, swelling, or tenderness here?
Nope.
No, and I see no redness or anything. I'm going to check the kinks in the tubing, and there are none, and it also matches your provider's order. And my patient does not have a... Okay. My patient does not have a urinary catheter, but if they did, I would go ahead and assess that, and we'd assess that and make sure that was okay. All right, Miss Kaylee. So I'm going to check your hair, and can I go ahead and check that?
Mm-hmm.
Okay. So I'm just looking for any breakdowns or rashes or bald spots or anything of that sort, and I do not see anything, so that is good. Okay. I'm going to check your body for warmth. So I'm going to check your arms, and if you didn't have pants on, legs as well. Okay, so body is warm and equal bilaterally. Skin tone is good for your race, and I see no edema or wounds. Do you have any wounds I should know about?
No.
No. Okay. So can I see your hands? I'm just going to assess capillary refill. 3 seconds or less. Okay, good on that hand. And on the toes as well. All right, good. So patient has good capillary refill, and so that is good. Can I go ahead and check your eyes? Okay, can you follow this pen light with your eyes? Okay, now I'm going to shine a bright light in your face. Could you hold your hand like this? And I'm going to do it about 4 times. Okay. Okay, so patient's pupils are equal, round, reactive to light and accommodation. I'm going to go ahead and check your ears. So just looking for any breakdowns or drainage or anything of that sort, and I do not see anything. Can you look up for me? I'm going to check your nose. Okay, nose looks good, no drainage. And can you open your mouth and say, ah? Ah. Okay, so uvula is midline, pink mucous membranes, everything looks good there. Salivary glands look good, mouth is moist. So that is a good finding. Okay, now I'm going to check, could you smile for me? Okay, so patient's face is equal bilaterally. Could I have you turn around and face this way here? Alright, now I'm going to assess your breathing sounds. When you feel this metal on your back, go ahead and take a big deep breath for me. If at any point you feel lightheaded, let me know and we'll go ahead and take a break. Okay? Oh, and so the patient is going to have their shirt on for this assessment, but if I were in a clinical setting, I would have them take their shirt off and assess that properly. Okay. Okay, you can go ahead and turn back around. So the patient's breath sounds sound good. I hear no crackling or abnormal sounds, so that is good. And my patient does not need an incentive spirometer, but if they did, I would go ahead and teach them how to use that and have them demonstrate back to me how they learned how to use that. Okay, have you had any nausea, vomiting? Oh, sorry, a little too quick. I'm going to check your carotid arteries, okay? Okay, so I feel no thrills there. And can I have your from here? Okay, no thrills here either. Could you uncross your legs for me? Okay. No thrills on any of those sides, so that is good. I'm going to go ahead, I would palpate the point of maximal impulse, which is going to be 5th intercostal space on the left side, but I'm not going to do that today, and I would be looking for any heaves or lifts of that sort. Okay, I'm going to listen to your carotid artery, one side at a time with the bell of my stethoscope. Could you breathe in for me and then breathe out and hold your breath when you breathe out? Okay. So in and out. Okay. Okay, and do that one more time. Okay. So no bruise there, so that is good. And now I'm going to check your heart in a couple locations. So I'm going to start out on the right sternal border, 2nd intercostal space, which is going to be our aortic. Now I'm going to move to your pulmonic, which is going to be left sternal border, 2nd intercostal space, then your Erb's point, which is going to be left sternal border, 3rd intercostal space, then your tricuspid, which is going to be left sternal border, 4th intercostal space, and then your mitral, which is going to be left sternal border, midclavicular line, 5th intercostal space. So I'm going to go through first with my bell, and then I'm going to go through with my diaphragm. And I would also be doing this on the patient's bare chest, but for this situation, she'll have her shirt on. Okay, one more time with the bell, or diaphragm. Okay, so patient's heart sound good, no irregular rhythms, S1 and S2 are intact, so that is good. Okay, have you had any nausea, vomiting, or diarrhea recently?
Nope.
Okay, and when was your last bowel movement?
This morning.
And was that normal or abnormal for you?
Normal.
And are you on any dietary restrictions?
Nope.
Okay, so could I have you lay down on your back for me?
Yeah.
Alright, so also for this situation, patient is going to have her shirt on, but in a clinical setting, they would have their shirt off. So just looking at the patient, I don't see any abnormal lifts or heaves. Could you lift your head up a little bit for me? Okay, yeah, so no abnormal bulges coming out. Stomach looks good for her shape and size, so that is good. Alright, now I'm going to listen to your stomach in all 4 regions. Alright. Okay, so patient's stomach sounds normal, and if I didn't hear any sounds, I would listen for 5 minutes in each quadrant. So, now I'm going to palpate your stomach. I'm going to first start out with one hand, it's going to be light palpation, and then I'm going to go through with 2 hands and do a deeper palpation. If at any moment you feel uncomfortable or some type of pain, you should let me know. Okay? Okay, no pain there?
No.
Okay, and I don't feel any abnormal findings there, nothing popping out to me. Okay. I'm going to go in a little deeper. Any pain there?
No.
No? Okay, and no bulges or anything there. So you can go ahead and sit back up. Okay, and have you been urinating more frequently than usual?
No.
Okay, and when was the last time you urinated?
Probably about an hour ago.
And was that normal or abnormal for you?
Normal.
And how many times a day would you say you urinate?
About 3.
About 3? Okay. And I would assess the patient's input and output for the urine if I needed to do that. Okay, now I'm gonna, have you had any swelling, tingling, or burning in any of your extremities?
No.
Okay, can you squeeze my hands? Okay, and can you push down against my hands like you're driving? Okay, and can you push up against my hands? Okay, so patient strength is intact, so I would give them a 5 out of 5 on that. And do you know where your call button is?
I do not.
Okay, so here's your call button, and basically what you're going to want to do is just click this button right here. Could you show me that you know how to do that? And that's going to alert us that you need help. Is there anything else I could help you with today?
Nope, I think I'm good.
Okay, and your bed is at a comfortable level, your handrails are up, so that's all good. Alright, and then I would wash my hands and